Mrs. Brown is a 65-year-old and has recently been admitted to the Diamond Hornet Rehabilitation Center after right hip replacement. She needs assistance with morning care, range of motion, and positioning. Please record yourself implementing the following skills as a human subject. Skill 1, hand hygiene. Skill 20, provides mouth care. Skill 11, gives modified bed bath. Skill 15, performs modified passive range of motion for one knee and one ankle. Skill 17, position on the side. Skill 1, hand hygiene, consists of me addressing my client by name and introducing myself to my client. Then turning on the water at the sink, wetting my hands and wrists thoroughly, applying soap to my hands, lathering all surfaces of wrist, hands, and fingers, producing friction for at least 20 seconds, keeping my hands lower than the elbows and the fingertips down. I'm going to clean my fingernails by rubbing fingertips against palms of the opposite hands, rinsing all surfaces of my wrist, hands, and fingers, then using a clean dry paper towel to dry all surfaces of my hands, and using another clean dry paper towel to turn off the sink. I'm going to make sure that my hands do not touch the sink at any time. The second skill, providing mouth care, consists of me explaining my procedure to my client, speaking clearly, slowly, and directly. I'm going to provide privacy with a curtain, screen, or door. Then I'm going to make sure that she is sitting up in a 90-degree angle or 75-degree. And I'm going to put on clean gloves before cleaning her mouth. I'm also going to put a towel across her chest before providing mouth care. And then I'm going to moisten her toothbrush with a cup of water. And then before I clean the mouth, I'm going to apply toothpaste. I'm going to clean all surfaces of her mouth, including her tongue, using gentle motions, maintaining clean technique with placement of toothbrush. And I'm going to hold the emesis basin to her chin while my client rinses her mouth. I'm going to wipe her mouth and remove her clothing protector. I'm going to dispose of the used linen into the soiled linen container, rinse toothbrush and empty rinses and dries basins. And then I'm going to remove and dispose of my gloves without contaminating myself into the waste container, and wash my hands and make sure that her signaling device is within reach and her bed is in low position. The third skill on the list is giving a modified bed bath, face and one arm, hand, and underarm. This consists of me explaining the procedure, speaking slowly, and directly, making face-to-face contact with my patient, providing privacy with a curtain, screen, or door, removing her gown, and placing the soiled linen into the container. Then I'm going to check the temperature of the water for safety and confirm with my client that it is an okay temperature. After that, I'm going to put on clean gloves before washing my client. I'm going to begin with her eyes, washing her eyes with a wet washcloth, no soap, using a different area of the washcloth for each stroke, washing the inner aspect to outer aspect, then proceeds to wash her face. After I wash her face, I'm going to dry her face with a dry cloth towel / washcloth, and I'm going to expose one arm and place a towel underneath her arm, and applying soap to the wet washcloth. And I'm going to wash her fingers, including her fingernails, hand, arm, and underarm, keeping the rest of the body covered. I'm going to rinse and dry her fingers, hand, arm, and underarm. I'm going to make sure that I'm moving the body gently and naturally, avoiding force and overextension of our limbs and joints. Then I'm going to put a clean gown on my client. I'm going to empty, rinse, and dry the basin. Place the basin in a designated dirty supply area. Dispose of the linen into the soiled linen container. Avoid contact between candidate clothing and used linens. And then I'm going to remove and dispose of my gloves without contaminating myself into the waste container and wash my hands. And make sure that her signaling device is within reach and her bed is in low position. The fourth skill on the list is performing modified passive range of motion for one knee and one ankle. I'm going to start off by explaining the procedure and speaking clearly and slowly and directly, maintaining face-to-face contact with my patient. I'm going to provide privacy with the curtain, screen, or door, ensure that the client is in supine position in the bed, and then I'm going to instruct her to inform the candidate, me, if she's in pain. I'm then going to perform flexion and extension, supporting the leg at the knee and ankle at least 3 times. And for the foot, I'm going to perform dorsiflexion and plantar flexion at least 3 times while supporting the foot and ankle. After I finish those exercises, I'm going to make sure that her signaling device is within reach and her bed is in low position, and then I'm going to wash my hands. The last skill on the list is positioning on side. I'm going to start off by explaining the procedure, speaking clearly, slowly, and directly, maintaining face-to-face contact with my patient. I'm going to provide privacy with a curtain, screen, or door. Then I'm going to lower the head of the bed or make sure that the bed of the head is lower. Then I'm going to raise the side rail on any side that the body will be turned. So I'm just going to let down the side rail that I'm on because I will be turning her to that side. Then I'm going to place or adjust a pillow under her head for support. I'm going to reposition her arm so she's lying on her arm and place a pillow between. And then I'm going to place a pillow between her legs as well, making sure that her knee and ankle is supported. Then I'm going to make sure that her signaling device is within reach and her bed is in low position. And after completing the skill, I'm going to wash my hands.